I remember entering the consult room one morning and greeting Mark, who wore a big oversized toque and a giant smile. As usual, he seemed engaged and eager to manage his diabetes better. But after a whole year of working with him, nothing had changed. His blood sugars were still wildly out of control, and his eating habits were poor. I really wanted our discussion that day to be different. I didn't want him to live the rest of his life with the potentially terrible side effects of unmanaged diabetes. As we started reviewing his home readings and recent lab work together, I knew that things were still the same, if not worse. Have you been taking your insulin? Or have you forgotten any doses? Nope. I have been using the long-acting and taking my short-acting with meals. Okay. What have your meals been looking like? Well, I usually skip breakfast, but I always have a good supper. Do you snack throughout the day at all? And what do your suppers typically look like? No, I don't really snack at all, and I usually have a big bowl of soup or noodles for dinner. Can you tell me a little bit more as to why you typically eat this way? Well, it's half habit, half necessity. Suddenly, it was like the lights turned on in the clinic room as Dr. Joseph and I both stopped and looked at each other. We had been working on a project for the past few months about reducing the impact of financial strain on people's health, and that phrase, half necessity, took on a whole new meaning. We paused for a long time as our treatment plan whirred through our minds. We had planned to refer Mark to a retinal consultant, a healthy living class, a dietitian, and we're already thinking about different interventions we could use to mitigate his progressing diabetic complications. But instead, I turned back to Mark and asked, "What do you mean out of necessity?" He squirmed a bit, coughed, and with an awkward smile said, "Well, I don't have that bursary for school anymore, and I haven't been able to find a job yet. And my mom lost her job recently, so we just don't have a lot of money for food right now." Over the next month of weekly meetings with Mark, our team helped him apply for Alberta Works, provided him letters of support for various government programs, brought in his sisters to expand his support network, and arranged for his medication coverage. In one of these meetings, we talked about his goals for the future. He had been studying to become a lawyer. He said he didn't come from much, but that he was going to break that trend. Later in that meeting, we found out that he hadn't been accessing the food bank yet, and Dr. Joseph said, "Mark, no one reaches their goals alone. Most people need help at different times in their lives. We want to see you succeed. You need to access the food bank, and if it is not enough, then I will help pay for the rest." 3 months after the first pivotal meeting, Mark is now eating regular meals, and we have finally began to discuss meal planning, retinal treatments, resume support, and working with a chronic disease nurse. We had to lay a foundation before putting up the walls and the roof, and just like Mark, we needed the support of other community agencies to do that.